Dr. Argo Chatterjee, and I welcome you back to the second part of mental health and homeopathy. This second video is intended for practicing homeopaths in order to give them some few valuable tips and tricks so that they can trace out mental illness in diseases with pathological background. Everyone else is always free to watch, but one of the advice I will give is that I will describe many medicines for different types of symptoms in this video. It is advised to anyone who has not got a medical background not to use any of these medicines without the advice of a designated homeopathic physician. These approaches I have learned from Dr. Sunil Saka. During his practice, I have seen these approaches to be very much successful while he has been treating his cases. And also, when I use these approaches in my own practice, I have seen them to be very much beneficial. So, let's start a discussion with few medicines in our background. Let's start with Ignatia amara. Ignatia is one of the leading remedies for depression. It is known for its contradiction, and also it is the most acute drug. It is very much indicated in the acute phases of depression. In many pathological cases, it can be the first choice of remedy, as in any pathological cases which has originated from elements from different suppressed emotions or suppressed grief, who has got some sort of mental trauma in the past, from which the pathology has started. Ignatia, it can be used in many emergency conditions as well. Ignatia's symptomatology is such that there is acute pain in the chest or stomach, which can be indicated by a point of a finger. When this symptom comes up, we can think of Ignatia in most of the pathologies where there might be grief, there might not be grief. As homeopathic medicines, we know they can be used for a range of symptoms, but Ignatia also has got both mental symptoms and physical symptoms. In mental sphere though, it has been widely used with much success. The next remedy we are going to talk about in depression is obviously Natrum. This is one of the medicines which follows Ignatia very nicely. In most of the cases where we get a Natrum constitution of a patient, we often start the cases with Ignatia. Natrum is one of those medicines which we can easily try and find out from physical constitution and generalities of a patient. This helps us. From these generalities itself, we can trace out we can make an idea of what has happened in the past. With further questioning, when we go to the mental symptoms, the mind part of our case taking, when we ask the patient of what has been the cause of all these things, has he undergone any mental trauma or emotional trauma in the past, it generally comes up that there has been such history. And particularly, I would like to emphasize in this one place, most of us has got some sort of mental trauma in their past. So Natrum is one of those medicines which can come up for many individuals, many patients, many people in any pathological cases as well.